Hi, many people out there who are suffering from chronic neck problems, headaches, mid-back, as well as lower back problems can benefit. Many of you can benefit from this particular technique. Understand that the skull, the entire skull, the cranial region, is made up of 22 movable bones within the skull. They're not totally fused. They are actually separate movable bones that actually moves when the cerebrospinal fluid, which is the covering around the brain and spinal cord, circulates from the brain down the spinal cord. It's kind of like a pump where it opens and closes, but so minusculely that you cannot really even see it. But there is slight movement when the change of this cerebrospinal fluid circulates throughout the central nervous system, through the brain and spinal cord, that by circulating this particular fluid helps accelerate the entire health and well-being of your body. So by doing this particular stretch, it's been proven that by opening up and stretching this particular part behind the occipital region, which we're going to reach behind the skull, and we're going to pull forward, and you're going to keep pulling till your chin comes down to your sternal area on your chest, and you're just going to keep pulling. You're going to hold it there for about 30 seconds. And when you hold that down there, you're going to feel a pull, a stretch behind the mid-back, behind the skull, and hold it there just for 30 seconds. This particular pump within the central nervous system, around the brain and spinal cord, the cerebrospinal fluid, which is the fluid that continues to circulate, it never stops circulating. And as it continues to circulate, you have this little pump kind of opening and closing, and this has to work hand in hand with all the organs, tissues, and cells within the body. There's a direct relationship between the neurological system and all parts of the body. So when you hold that stretch for 30 seconds, after you release it, you should feel a whole lot lighter, hopefully a lot less tightness, a lot less spasming, but most important, give it some time, because this will help hopefully reset specific parts with the nervous system. Hopefully this will take away a lot of your pain, a lot of your spasm. You can do this stretch once or twice right after each other. You can do it 2 times, 30 seconds. You can do it daily. Very safe. It's very different than just stretching the muscle. You want to take it to the point to where you can really get that end pulling sensation back on the cranium and hold it. But again, if there's pain, cut back, because we don't want to do anything when it comes to pain. Make it a great day. I'm Dr. Alan Mandell.